we understand that gender incongruence and gender in itself is an experience that is extremely culturally sensitive. But at the same time, while looking at something like healthcare delivery, it's important to look at the pre-existing examples that we already have in terms of more developed systems of healthcare dissemination. Now, one of these examples is the WPATH, which is the World Professional Association for Transgender Health. And to sort of share the vision of WPATH, we have Dr. Gail, no, actually, we have Dr. Walter who sent in a video today. So I think to start off with, we're gonna look at that video and then we're gonna move on to all of our speakers. Yeah.
Hello, everybody. My name is Walter Baumann. I'm the current president of WPATH, the World Professional Association for Transgender Health. Dr. Sharma asked me to say a few words about WPATH. We are a relatively young professional organization founded in 1979 by a group of clinicians and academics who were looking after transgender and gender diverse people at the time. Our mission is to promote evidence-based care, education, research, public policy, and respect in transgender health. We envisage a world wherein people of all gender identities and gender expressions have access to evidence-based healthcare, social services, justice, and equality. Now, we undertake many activities, and for anyone interested, I refer to our website at www.wpath.org, but I will mention two important products, if you like, that we have. The first one is the standards of care, which are clinical guidelines to promote the highest standard of healthcare for trans and gender diverse people based on the best available science and expert professional consensus. The next version, which will be the 8th, is currently worked on by about 150 clinicians and clinical academics from all around the world, and will hopefully be ready by the end of this year. The second important pillar of WPATH is our Global Education Institute, or GEI, as we call it, which is spearheaded by Doctors Ren Massey and Gail Knudsen, who will tell you all about what GEI stands for and what GEI does globally. So I will leave you with that. I'm sorry I could not join you today, but hopefully we'll stay in touch. All the very best. Bye-bye. Bye-bye.
Right. So now that we have a bit of an idea about what WPATH does, I think it's kind of important to look at what we're doing, especially in the Indian subcontinent. When we talk about healthcare, we talk about the importance of training people for healthcare, and who better to talk about the training of healthcare than people who work in management. Now, as a professor of IIHM, I don't think there's anybody more qualified to talk about the future of transgender healthcare management than our next speaker, Dr. Sutapa. So, Dr. Sutapa, please, the floor is yours.
Yeah, good morning, good evening, good afternoon to all the participants who have joined in for this important debate. So first of all, I would just like to emphasize on one thing, that the healthcare needs of transgender population is same, or in some conditions it is much more than the cisgender population also. So when we say healthcare, we mean that the care requires a multidisciplinary team. And when we say multidisciplinary team, it doesn't mean only doctors from different specialties. It includes nurses as well as the healthcare managers, who are primarily responsible to produce and create and facilitate an environment under which the doctors and nurses, they can produce the best possible results. There are several barriers which have been documented in the literature for transgender healthcare, and some of these include the financial barriers, the socioeconomic barriers. There is a lot of stigma and discrimination at the healthcare facilities. There's lack of cultural competencies among the healthcare providers. And these are just few from a lot of other causes which are posing to be a kind of a hindrance to providing effective healthcare services. Now, in India, there are certain institutes where this kind of a care is provided, and these are generally provided in the public tertiary care setups. And India, as we know, that 80% of the health care is provided by the private sector. We really need to expand our horizons and reach to include the private sectors, because that is one sector where a lot of the multi-speciality kind of a team may not be available under the single roof. Moreover, in India, also after the Act came into being in the last year, 2019, I think a lot of efforts are now being made to ensure that appropriate transgender healthcare is provided even at the secondary and the primary care level. So first of all, the problems which we are facing is a dearth of healthcare providers who are knowledgeable about the needs of this particular community. There's lack of insurance coverage, stigma among both the providers and the caregivers. And in order to meet all these requirements, it is of utmost important that we do research and document these findings. The only thing which can move policies are good evidence-based data. So here I would like to emphasize that IHMR, being one of the first institutes in the country to have realized the importance of management in healthcare, and that is why we were the first institute in the country to have started the course on health and hospital management. And currently, with this 35 years of legacy and with more than 4,000 postgraduates who are now posted in different hospitals across the country, we actually can provide a very good resource for the delivery of healthcare management. Even every year, if you see, there are around 400 to 500 students who graduate every year. So on behalf of IHMR, I assure that we would try to provide all kind of support to ensure that at least our student gets sensitized to the principle and concept of transgender healthcare. So I am very confident that even if you are able to motivate 10 to 20% of the people, in the longer run, we would be doing a huge commitment to this society. Thank you so much.
Thank you so much, ma'am. That was wonderful. Talking about education, education is a key stepping stone in life. But for a lot of trans people, education is something that they tend to miss out on. Now, especially with the new Education Act on our hands, I think the next step to talk about, especially in providing a holistic framework of transgender healthcare delivery, is education. We're looking to talk about education reforms that are looking to include trans people. And here to talk about that, we have a professor from Delhi University, a very esteemed professor, Dr. Rajesh. Sir, if you could please take the floor. I think.
Yeah, hello.
Good evening, sir.
Hello, good evening, everybody. I am Rajesh. I am Rajesh, professor and head faculty of social sciences, University of Delhi. And we are running a transgender resource center for education and awareness of transgender in University of Delhi since a couple of years, rather more than a decade. And lots of transgender community people are associated with our initiative. And I have contributed education and employment opportunity for transgender for the Transgender Act 2019. Rather, before that, before the NALSA judgment was made, the Government of India, Ministry of Social Justice and Empowerment has an expert committee to deal with the various facets of transgender community. And under that, I have contributed education and employment opportunity for transgender. Currently also, I am engaged in training and making advocacy of various transgender community people, college principals, university heads of the department, students, and other stakeholders, for example, Anganwadi worker, ICDC workers, police personnel at various states of India, jail personnel at higher and lower levels, And I have addressed more than 30 sessions for these groups at national level for the ministry for training on the, especially on Transgender Act 2019 and Transgender Rules 2020. There are so many things that we used to talk along with the counseling and guidance. Certainly, health remains a very, very pertinent issue, because the aspect of SRS, aspect of training the medical officers, aspect of training the nurses and other paramedical workers remains the very high level issue among all the sectors, that in spite of the act and rules, in spite of the judgment that is available, NALSA level judgment, what is happening that it is not translated in reality. It has not come at the grassroots level, because most of the stakeholders are yet not aware about the act and rules, and also that they should get better treatment by the community. You rightly mentioned that new education policy 2020, after the independence, for the first time, it is talking at least about the transgender fund for the girls and transgender, persons, and this will help in sports and culture and other activity of the transgender community. Even during the pandemic, some financial assistance to the tune of 1,500 is given to the community by the ministry, and in 13-14 state, Garima Grih, the House of the Pride, is already established, including in Delhi. Garima Grih is established and it is functional. In remaining states, the Garima Grih will be further functional for their rehabilitation. Now, the issue and challenges remain, certainly among them. Health remains the top important issue. That how about the health, the personnel are being trained, and how they should be given a true kind of a justice. So what we are doing through our university initiative, that we are taking a national level initiative through the Ministry of Social Justice, that how we should make them aware about the rules, about the law, and how they should be educated and make their behavior change towards the communities, so that in the family, so that in the society, and at the community at large, they get the justice along with the line of the act, and along with the line of the rules. So nearly thousands of students and the teachers are being trained in the various colleges on the aspect, but it is not a one time affair. It needs a kind of a regular intervention on this aspect. So far as University of Delhi is concerned, at the highest, at the helm of affair, the Vice Chancellor and the principals have recently addressed. We have a program at national level where our Vice Chancellor and the ministry people have discussed the act, and we are looking that University of Delhi will be implementing it at a large, because University of Delhi is by and large is a national center with 72 departments and 89 colleges spreading in entire University of Delhi, and having population not only from India but from developing countries. So accordingly, we are envisaging that along with your health initiative, with the WPATH, that will able to have some kind of a meaningful intervention in course of time. I think for the time being, I will have this, say. Thank you.
Thank you so much, sir. Before we, move any forward, I would just like to tell everybody who's watching that it's going to be a Q&A at the end of all of this. So please, any questions you have to any of our speakers, do feel free to leave them in the chat section, and we shall read them out. Now, jumping on to the next set of speakers, I actually want to piggyback off of what Sir Rajesh sir just said, talking about the grassroots level and how there needs to be a change that needs to occur at grassroots level, and how this sort of ties into the point being made about education. Now, the next two speakers that I'm going to ask to come on the floor are going to be talking to us exactly about this. We have Dr. Jen Massey and we have Dr. Gale. And not only do I want both of them to talk about the Global Education Institute, but also about the importance of using programs such as the GEI in order for transgender community members to further empower themselves and step into community leadership positions. So with that being said, I think I would like to hear from Dr. Dale first and then Dr. Dan. So please take it away.
Thank you, Taya. And good morning, good afternoon, good evening, everyone. I'm saying hello from Victoria, Canada, or close to Vancouver, Canada, and I'm a clinical professor at the University of British Columbia here in the Faculty of Medicine. I'm a past president of WPATH, and I work with my colleague and friend, Dr. Ren Massey, as the co-chair of the Global Education Initiative. I want to tell you a bit about GEI, and it started close to about 5 or 6 years ago now as an initiative from the board as part of our strategic planning. And we had, when it started, we gathered people that were from different areas of expertise in transgender healthcare, also education, and we came up with kind of broad areas of the curriculum that we wanted to focus on. So one area was medicine, one area was mental health, and the other had to do with, and this goes to what Tara was saying about looking at transgender health in all different levels, grassroots levels, all the way up to managerial training and different areas to do with the law and to do with equity. So what we have done in terms of our programming is focused on these 3 different areas. We've had also curriculum experts be part of the development of the program, as well as content experts be part of the development. And we also have within WPATH, within the GEI, a certification program of which Dr. Sanjay and his colleagues have been part of, and they are going to be on their path to certification within the Global Education Initiative. So we have been very active in the past 3 years doing mostly in-person training in the United States, as well as some as well as countries in Asia and also in Europe. Right before the pandemic started, actually a couple weeks, we were in Vietnam training, and then we were just on our way home. Ren's nodding his head. We were just on our way home, and everything was closing down. So we are very interested in working with people from across the globe, and also very interested in learning about what healthcare and healthcare systems are available and in place. And we also partner with the healthcare professionals and management professionals and lawyers in that country, as well as people from the trans and gender diverse community to be part of the faculty and in terms of the presentations. Over the last year, we have had, as you all know, we've switched to a virtual world, and so we shifted our training to a virtual platform. And in many ways, this has been a gift for us in terms of being able to learn from people all over the world, and also to have very many more faculty from all over the world. And I think that Dr. Ren can talk about this, that we've been having trainings and having people from, I think our last training, we had people from 24 countries. So not only can we invite people in from different countries, but also have faculty from many countries, many more countries. And we think that that experience is richer. So we've been working with Dr. Sharma and his team about the curriculum, developing the curriculum in terms of for AIMS, and along with the working with the National Medical Council, and I'm sure that Dr. Sharma can say more about that. But I'm really, really pleased and honored to be part of this project on behalf of WPATH and also GEI. So Ren?
Thank you, Gail, and thank you, Dr. Sanjay, for inviting us to be here today. And Tia, you're doing a great job with bringing us all together in this conversation that we're all interested in. I'm coming to you today from the Atlanta, Georgia area in the United States. And I was the past president of the Georgia Psychological Association. I'm currently co-chair, as Dr. Gail said, of the Global Education Initiative in WPATH. And the few things I'd like to share with you about that is to build on what she was saying. You know, one important part of the training opportunities we have in WPATH is a certification program. We offer certification for mental health medical providers, and we are working on building in certification for voice and communication specialists, for surgeons, for physical therapists, and other medical mental health professionals over time. And the way they obtain certification in our program is by taking our foundations courses, as well as some of our advanced courses in medical or mental health, or ethics, or child and adolescent care, which is a specialty area in and of itself. And then also getting some continuing education in other venues, and doing community listening hours, as Tia was saying, and as a few people are getting. The community input is really important in this field of care. And that is a thing that I appreciate in WPATH in many ways. For example, in the standards of care that Dr. Walter mentioned earlier, we have community members involved in each of the chapters that are being updated and written for the newest version of the standards of care that will come out hopefully later this year. We also, in addition to community listening hours, we have mentoring, and that's 10 hours that are required. And for Dr. Sanjay, we've had a special program where Dr. Gail and I and another professional who's going to be talking to you by video shortly are training him to address different areas to help him with his vision of bringing together professionals and across the Indian subcontinent to advance healthcare to reach as many people as possible in the ways that y'all are working so well together already, and to advance that further. One of the things I really like is his vision of engaging community members to inform the efforts, and also to help in providing services and publicizing the services that y'all can offer. You know, mental health needs are also very important for folks. The medical needs are, of course, very important, but mental health is very important because many of the folks who are transgender or gender diverse face many stressors and forms of discrimination in jobs, family rejection, bullying in school settings, so they leave school, or because they've been kicked out of the family, they leave school. All of these things prevent them from contributing to society, from getting their education, and from functioning as well as they could. And so a lot of mental health support is needed for coping with these stressors and getting back on track and leading productive, healthy lives, psychologically, socially, and physically healthy lives. One of the important things in our trainings, you know, Dr. Gail was talking about, is that we have a variety of folks and we collaborate with the professionals wherever we work. And we work with training, not just the professionals, but the management and the administration where we train, whether it's in prison settings or hospital settings, because we know that those folks are so important to being able to instill and enforce and develop policies and coordinate care systems. So we really recognize and value the contributions of administrators and management professionals. I would like to say also that it's been exciting, as Gail said, to have professionals from around the world attending, but also engaged as faculty members. In the last mental health program I ran, we had faculty from not just the US and Canada, but Brazil, the Netherlands, Poland, and for the first time from India. And it was just such a rich exchange of information and experiences. I want to add that a number of the faculty are transgender. So we have some transgender women who transition male to female, and we have some transgender men like myself who have transitioned female to male. And we bring not only our professional expertise, but share our personal experiences to try to enrich the dialogue and the educational content. And finally, I just want to reinforce what Dr. Gale has said and what some of the others have said. We are looking at a multidisciplinary type of effort here, and that is part of why hospital management and administration is so important, to be able to engage and bring together the multiple disciplines of endocrinology and surgery, but also psychiatry, psychology, and other primary care, HIV prevention, and more. So we look forward to finding ways we can partner and assist in providing more healthcare services in the Indian subcontinent. And thank you for your inviting us to be a part of the program today.
Thank you so much. That was wonderful. While she couldn't be here today, you mentioned Dr. Jennifer, and Dr. Jennifer is the medical director of the multi-specialty transition clinic in Oakland, California, and she sent us a pre-recorded message on understanding the specific needs for the delivery of transgender medicine. So I think we can all now take a look at that.
Thank you for the invitation to speak with you today. I apologize that I'm unable to visit with you in real time. My name is Dr. Jennifer Slovis. I'm a primary care physician by heart and in training here in the United States. And I'm the medical director of a multi-specialty clinic in Oakland, California, that is dedicated to comprehensive healthcare for transgender and gender diverse people. I'm also a medical mentor for the World Professional Association for Transgender Healthcare, WPATH. And my colleagues, many of whom you will meet today, and myself are working with Sanjay in his efforts to build a gender-affirming model of healthcare in India. My specific skills are in hormone management and preventive primary care needs, and I work with a team of other physicians, for example, surgery and gynecology, and specialized nurses and gender mental health therapists. And together, we practice evidence-based gender-affirming care. Not every patient has the same pathway. Some will want hormones, some surgery, some just support and validation of whom they are. There's no one way to care for transgender people. For far too long, transgender and gender diverse people have faced discrimination, stigma, and exclusion from comprehensive and quality healthcare. For many, even accessing basic health needs has been impossible. And as you begin to work with gender diverse people, you will learn about the immense health disparities they face as a community. High rates of mental health problems, suicide attempts, substance abuse, HIV, and poor health outcomes across the board. And yet there is nothing specific to being gender diverse that predisposes someone to these conditions. Rather, pervasive society stigma, discrimination, oppression, and violence drive these health disparities. And they can be reversed. When people have welcoming and affirming access to comprehensive health care, and we have many decades of research proving this, they can truly thrive. When people can live in bodies and experiences that affirm who they truly are, they are more likely to want to take better care of those bodies. We will see this attention to healthier living spill over into non-transition related aspects of medical care as well, such as better control of medical disease, like diabetes or high blood pressure or less substance use. or higher rates of immunizations or preventive care exams. Not only will the cost of these health disparities that tax our medical system go down, but we will see the costs on people's lives go down as well. Families will not lose those beloved members. Communities will not suffer from a lack of valuable and productive people. And our society will benefit from a greater compassion fostered by this beautiful diversity. I invite you to be the next generation of healthcare providers who want to partner with gender diverse people to have access to and lead healthier lives. At first glance, the creation of a comprehensive healthcare clinic might seem complex. Every patient has individual needs. And how to build this space with the challenges of everything else we're experiencing in healthcare, such as the pandemic, will require much discussion and creativity. Many pieces will need to come together. Your providers and staff will need education about best practices and cultural sensitivity to create a welcoming and affirming clinical space. There are excellent examples of community clinics from across the world, and you can use this as a foundation. In my experience, I see three key components in a successful integrated care model. The first is having a nurse or case manager who can help your patients navigate the various aspects of your system of care, ideally in a community outpatient model. The second is physicians, providers, and staff who create comfortable and welcoming environments to build trust with patients and the greater community. And the third and most important, build your program with your community in mind. Invite your gender diverse community to the table. Find out their needs, listen to their voices, and make sure that their suggestions are incorporated into your model of care, whether through gender diverse patient advisory councils or by reaching out to community organizations to learn about their challenges and how the care experience can be improved. This is vital to make sure your patients will trust and have an investment in your clinic. I've been so fortunate in my professional career to have been able to help build a comprehensive care, gender diverse clinic in my country. And I'm so excited to see how truly transformative healthcare can grow for gender diverse communities in India. The immense improvement in healthcare outcomes is undeniable. And the affirmation of living a life with purpose and respect and gratification will be shared by your patients and your providers and staff alike. Thank you.
That was right. So now we're going to be hearing from Dr. Shibu John, Dean of the Department of Healthcare and Pharmaceutical Management at Jamia Hamdard. Dr. Shibu has been a mentor and a guiding light to our organization. This event was put together in collaboration with Dr. Shibu. So, Dr. Shibu, I invite you to take the floor and
yeah, good afternoon, good morning, everyone. My name is Shibu John. I am professor in the Department of Healthcare and Pharmaceutical Management at Jamia Hamdard. And I am currently Dean of the School of Management as well. And I'll just briefly mention about my university. University is almost 40 years old, and the various programs that we offer are professional, and the university is tilted towards the healthcare programs. That means that we have public health programs, we have medical college, we have allopathic medical college as well as Unani traditional medical college. We have a very renowned pharmaceutical department where we offer all the pharmaceutical related courses. And of course, we are running many programs on public health, hospital management, healthcare management. And let me tell you that, we have been very fortunate that we have associated with ATI and Dr. Sanjay Sharma. And we have been doing work in last 2 years. We have conducted 2 international conferences. We have published 2 books that were outcome of this conference. So, we have already, started doing many work on this area. So probably this is perhaps the first time that the biggest bodies of international and national level on transgender health are collaborating and planning to address this issue together. In this regard, I would assure everyone that Jamia Hamdard will always be there as an important pillar in supporting this challenge. As many of you know, that transgender topic was never given priority in India till very recently. but the situation is changing and people are coming forward in their gender identity. And that is basically giving a lot of scope for this particular field. This has opened up new avenues for professionals who are working in the healthcare field. I would broadly categorize the healthcare requirement as medical and non-medical, interventional and non-interventional. The training requirement that further be classified for a training purpose as are school level education, counseling, mental health, gender clinic, public health, healthcare administration, psychiatry, endocrinology, surgery, and the list is very big. It's not possible for me to cover all the aspects as of now. I've been given the task of talking about the training requirement, but this is such a big area that I may not be able to touch on all the topics. We also need people to develop and conduct training programs in various subfields of the training transgender health that Jamia Hamdard has already started in collaboration with Ati. And to bring efficiency, I mean, particularly the health management or healthcare administration students are also required to address this issue, because we need to bring the efficiency in the whole process. And we need healthcare managers and administrators, as today that the healthcare services are broadly managed by qualified management graduates in all leading public and private hospitals. According to me, orientation towards transgender health needs are the first step in this direction. So orientation has to be there to all the healthcare providers as well as the seekers. And a country like India with 1.4 billion population, there would be a sizable TG population, and that requires healthcare. So the training has to be pan-India, not limited to only the metros. It cannot be done in one go. It has to be a continuous process from the district level to the state level. The country size is so large that the training programs are required not only in district level, but state level, medical colleges, various centers of excellence and research institutes. Like I mentioned, that Jamia Hamdard has already begun their initiative, and with the collaboration of Ati and Dr. Sanjay, we are in the process of making a center of excellence in Jamia Hamdard that will cater to at least the northern India part. And I'm sure that in next decade or so, transgender health will be offered in each hospital with over 50 to 100 bedded in the country. Accordingly, I see a lot of potential for healthcare professionals in future. And at the end, I must thank Dr. Sanjay Sharma and Nati for their relentless effort in bringing this topic in limelight. And they are very keen to bridge the gap that exists in India, particularly in the area of transgender healthcare challenges. I see a bright light at the end of the tunnel today with all the young professionals coming together in fulfilling their needs. I must say that India can take a lead in providing quality transgender health in this part of the world. And this part, because the huge sizable population, India can become a hub towards providing healthcare services to all the Southeast Asian countries or Middle Asian countries. And I would definitely seek the government and non-government institutions supporting this initiative. And at the end, I thank for giving me this opportunity to be with you and talk to all the participants from across the world. Thank you once again.
Thank you, sir. So I think we're going to be moving on to the question and answer section of this bit. I'm coming in hot with all the important questions. I think we're going to start with Dr. Rajesh first. So I think one thing that a lot of people want to know, especially in a university environment now, what are the kind of steps that have been taken to provide training to teachers for handling of transgender or gender non-conforming persons in a college setting?
You have asked a very pertinent question, that the training of teachers. If we see University of Delhi and its colleges, it has more than 9,000 teachers in 72 and 90 colleges of University of Delhi from various parts of the country, north, east, south, and all kinds of a thing. We have initiated the training and several college teachers and principals, vice chancellor have participated in the training program but certainly admitting that it is just the beginning. We have not able to train the maximum number of teachers and other stakeholders in the University of Delhi, and this is why it is happening that while doing the advocacy, it is happening that currently those who are placed in National Council for Transgender Persons, an apex body under the Transgender Act 2019 of Government of India, which is there for 3 years. Some of them also say that I aspired to take admission in University of Delhi and I was denied. So on the forum they used to say, and most of the students, those who used to come, they always share that we have lot many problems and bullying in a formal system, and even in non-formal SOL system we go, the teachers, the part you talked, are not sensitized, and not the advocacy is there so that they can handle the students, especially the students with gender diversity in the classroom system. So it is very, very important that in coming time, how we take more initiative and involve more partners in the university system in training the large chunk of teachers and other stakeholders, so that students taking admission around 50,000 every year, and among them all gender, are there. And the one thing that we will say, that there are so many PhD scholars who are enrolled on various aspects, one in right to education under me, who are working in various parts of the schools on training of that kind of a thing. One is working on their sensitization and education and at community level. But what they face, that even I had gone to the teachers, around 2,000 teachers in Delhi schools, but most of them, they say they have heard that something is there, they have heard that this community is there, they have seen them somewhere, that we say or anticipate, but they say that never anybody has come to them and ask about their admission and their problem. That means still today they are there in the schools and colleges, but they are not able to identify themselves the constitutional rights and other rights given in the act, that the system, teachers of the system is so much sensitized that they will give the justice. So you are very right that it is just the beginning for the teachers, training program, but lot many things have to go in this regard. Thank you.
Thank you, sir. My next question is to both Dr. Jain and Dr. Gale. And this is also like personal, I do want to know, how do we up the engagement, especially for people from the community, people looking to get involved at various levels, not just a professional level, but also grassroots activism level? How do we bridge that gap? How do we use tools such as the GEI to kind of get more community members, to get more trans people active in these spaces?
Do you want to start, Ren, or do you want me to start?
You can start if you're ready.
Okay.
Okay.
Great. Thank you for that question, Taya. Going back to what I was mentioning a bit, and I think Dr. Ren also said this, but where we see the trans people being involved, trans and gender diverse being involved in terms of the training, is to have them as being part of the facilitators or the faculty in the trainings. So this has been very, very well received and very popular, and it's a significant portion of the introductory area of our training, and setting kind of the landscape, as Dr. Rajesh was saying, that people are saying, well, maybe this community is there, maybe it's not, and this really opens the doors in terms of introducing the community to a much broader audience. Ren?
Yes, I would add that I think, like any minority group, the research has to be done strategically, and the initiatives have to be kind of strategic and creative, sometimes thinking outside the box. For example, there are often networks in minority groups. And so if one person knows one person, as a professional, if I am introduced to one person, then I can ask that one person to engage anybody they know, and then they talk to anybody they know. And so a lot of it starts out informally. And for example, when we went to Vietnam, one of my colleagues had a contact over there, and I contacted his contact, and then his contacts arranged for a number of people to meet with us when we were actually in Vietnam. So that was one way of engaging with the community and letting them talk to us about their needs and us being able to provide information to them. Another thing, there's research at places like the Williams Institute, which is at the University of California, Los Angeles, and some other researchers are using a lot of telephone kinds of apps to connect with folks, to develop networks of communication, to arrange meetings, to do surveys about needs. So sometimes if people are afraid to be out about being trans, then there are those kinds of mechanisms to be able to start to engage the community. And then finally, I would just say, that there's a phrase that I've heard used in the neurodiversity community, particularly in the autism community, that is starting to happen more and more also as a standard for research with the trans community, and that is the phrase, nothing about us without us. And that is to try to make sure to engage perspectives of trans folks, whether it's in an informal means or through formal connections, if you're able to establish those.
Thank you so much. Thank you so much. I think the next question is for Dr. Shibu. Now, Dr. Shibu, when we want to kind of talk more about the need for short-term courses, especially in terms of management and management specifically for the dissemination of transgender healthcare. Now, could you please tell us a little more about those and what the importance of those is?
See, training programs in any aspect is very important. And since, the transgender health has not developed as such for a long-term programs in India. So I discussed with Dr. Sanjay earlier also that short-term training program has a lot of scope in India. You cannot take out the general healthcare, and I mean, there is no much difference between general healthcare and transgender healthcare. There are many common aspects. So people who are already trained in general healthcare, if we provide them with a capsule 1 week, 2 week, or maybe 1 month training programs, particularly focusing on different aspects, it'll be very beneficial. And when we talk about the managerial training programs, in the management, we always look for, increasing the efficiency in the system, and efficiency as well as the effectiveness. We know that the resource is one of the important challenge in India. And that is what we teach in management students, that with the minimum resources, with limited number of hospital beds, with limited number of surgical, materials, how we can achieve maximum, healthcare. And now the transit TG population is disclosing themselves, identifying themselves. So with 1.4 billion population, you can imagine that number of healthcare requirement will be enormous, and the resources are limited. Hospitals are limited, hospital beds are limited, so there is no denial in that fact. So it will take some time to have those kind of facilities in future, but with the time limit, we have to manage with the limited resources. So I hope that short-term management programs to the healthcare professionals is very important, and they will bring a lot of cost benefit, procedure, cost benefits to the system. And I endorse those kind of short-term programs, and we look forward to conduct similar training programs and developing those kind of training programs in near future. And we have already, assured Dr. Sanjay and Ati that we will be doing that in next few years.
Thank you so much, sir. Now, sort of circling back to Dr. Sitapa, because I had made a note of this, ma'am. You'd spoken about the sort of research that your institute, IIHM, has undertaken, especially in terms of training of people for the needs of trans folk. Now, I was wondering if you could just give us a little more knowledge, a little more clarity on that. Like, what would a research like this undertake, and how can it be more widely applied throughout the subcontinent? What can we learn from what has already been done at IIHM?
Thank you, Tia. As I said, that research is an important pillar of education, of academics, of policy. So right now, when I was just glancing through the literature, I found that there are more and more documentations from developed countries. So I think we need to have a kind of a balance wherein we agree or disagree with the findings which are already documented from the West, and say whether our population is similar or different from their population. Accordingly, the needs will vary. Accordingly, the solution will also be different. So when I say research, I mean that the gaps which are there currently in the system, if people are not approaching the system, what are the actual reasons? And maybe we can get solutions from them only, the solutions with which they are more comfortable with. So now if we can do that kind of a research and analyze the gaps, analyze the strengths of the system, opportunities of the system, and then document them, then I think with proper advocacy, we'll be able to do justice to their needs. And that is what I mean by research.
Thank you so much, ma'am. I'm just gonna do a quick. Okay, we still have time for let's say a few more questions, so that's great. We're gonna continue interrogating all of our lovely speakers over here. But I think something that I kind of wanted to also volley this, right? The same thing that I asked ma'am about research. I also wanted to ask about this to Dr. Gale as well, especially considering that the WPATH has created a much more stable model for healthcare to be followed across the globe. Now, how do you think a country like India, in your experience, because you've spoken to and you've seen multiple countries that have gone on this journey. So, how would you think in an India-specific way this would work out, and any sort of advice that you could give?
Oh, I think that Dr. Sanjay has been, I don't know if he has shared in terms of the documentation about the models for clinics that he has developed, and these are based on different models that he has looked at in different countries. So I think that if these models can be replicated both in both rural and urban areas, that this will be really, really helpful and increase access to care. And going back to what Dr. Shiva was saying, that in terms of the education, that it not only has to happen in urban areas, but also in rural areas. And I know that coming from Canada, we've had difficulties with this in terms of people having better access to care in the larger urban areas, larger cities, versus in the more rural areas. And so what we have done in our province is have we've had different healthcare facilities in one section in each of the rural areas as well, in terms of the 5 health authorities. And that really has helped and increased access to care. And when you speak to people, I've worked in telehealth for many years now, video health, because we have such a rural and remote population here in BC, people didn't think that they had an opportunity to transition or like have hormones or surgery because they didn't live in the city. And so like reaching out and having these centers in a rural area, or, you know, having this telehealth available makes a significant difference, I find. And, you know, and then people can have their gender affirming goals met. And, you know, it might mean traveling to, you know, access appointments or something, but at least they have hope, and something does exist. And then, you know, people have more hope, but also I think that it increases awareness of the community. And I just wanted to kind of to bridge it to a different level in terms of, and I know that there's many like deans on here that Canada actually, well, in our province, we followed an Australian medical system where they had medical schools in rural and remote areas, and we have that distributed system now in 4 different areas of our province. And it promotes, you know, doctors coming or medical students going from rural areas, or people wanting to be doctors and nurses, and training in those rural areas. So it's in a way, it's just another way of looking at that system that's been very, very successful in our province, and also having that rural retention.
Thank you so much. I think that's about all the time we have for questions. I'm going to toss it over for closing statements to somebody who is really, you know, put backbreaking amount of work into this. It's somebody that I really do look up to. It's my own father. It's the CEO of ATI, Dr. Sanjay Sharma. So, Dr. Sanjay, please take us out.
Thank you so much, Tia. And thank you for you know, putting this whole thing together. I'm not going to take too much of time. I have one slide that I want to share with you, and that about sums up what we you know, vision for the Indian subcontinent. And why are we talking about the Indian subcontinent? Firstly, well, the Indian subcontinent shares the rich cultural heritage. And most of gender is about where the person is coming from. And that is why we want to take what we have learned from you know, world bodies like WPATH, blend it with what wisdom we have over centuries in this subcontinent, and put out a system where we can reclaim the leading to be leaders in diversity, to have all human forms enjoy a life of dignity. And so I have here a beautiful slide put together. So what we are looking for is information to flow from WPATH down to IPATH. And from IPATH, this information would be going to the subcontinent, the other countries, where we are going to have at least 2 gender affirmative care centers coming up. One in the rural area and one in the urban area. The one in the urban area, we wanted to connect this to universities. And that is why we had this discussion where we were asking people from academic backgrounds to join us. We link this to the Center of Excellence in Delhi. We get our flow of teaching or protocols to blend with what we have developed on our own, and teach and learn. Also, we start collecting data which starts flowing from the subcontinent back to WPATH. And why we need to do that? So that we have a team there which can analyze this whole data and tell us where how we can do things better. Thank you so much for joining in. And let me assure you, this is not the last meeting that we are going to be having. We're going to have multiple such interactions, and we want universities to come in. We want professionals to come in, but most of all, we want the people from the community to come in, so that it is really about doing something for people where they are involved. We also want professionals to understand that we need to do good and go by that first oath where we say, above all, do no harm. And for that, we need to learn. We really need to learn. Thank you so much. I think I have just about exceeded by 2 minutes. So we should say bye-bye. And God bless. Thank you so much. Thank you so much for being here.
Thank you so much to all of our speakers for coming through. Thank you so much, everybody, for joining us. This was truly incredible. Once again, a very sincere word of thanks to WPATH, to all the people from these huge management institutes, to Delhi University, for taking your time out and joining us here today. I've been Tia. I'm the creative director of ATI, and thank you so much. Stay safe. Have a great rest of the day, evening.